And in fact, in some cases it has gone up. Texas is a great example of that. A New York Times reporter whose name escapes me wrote this wonderful article comparing Texas in regards to the cost of health care, despite the fact that there was caps on all tort reform. And in this great article, which I can send you, because I can't remember the name of the title or the article, but he talks about how he's going in and talking to physicians on why the cost of care is so expensive in Texas, particularly these two counties that he's looking at, as compared to, say, in New York or some other place. And everybody says, oh, it's because of, it's because of malpractice insurance, it's because of tort reform, and every physician says that. And then he goes and he tells them, but you've had caps on this for 5 years, and there has been zero litigation in the state of Texas during the time that tort reform caps have been in place. So my point is that the idea is that it is a huge revenue saver, and it is not. The point is that despite the fact that states that have tried it, there has been no reduction in healthcare costs at all. And that is not to say that there won't eventually be, because it is more than just a numbers thing, it is a perception thing. As when he talked to every physician in Texas that he was talking to for the article, they all said it's because of my malpractice, but he was like, what are you talking about? There's been 0 cases and there's caps. So it's a perception thing. So once, if in places like Texas and Nevada where this has happened, it could potentially save money, but it will take time for the practice and the perception of the physician to actually change, to reduce defensive medicine, because it is an issue. Defensive medicine is an issue, and until the perception changes that they are no longer required to do that because the law does protect them, because the amount of defensive medicine did not change. That was the issue, that despite these caps, the practice of the individual physician did not change.
But the insurance companies did not drop any rates down to their malpractice insurance, that they stayed about the same.
That's not true. In Nevada and Texas, they did. The only thing, the cost of the insurance dropped for the physician. But the amount of health care that the physician was providing and the cost of it did not change for the patient. So the overall health care cost to the society, to the patient, there was no change. The cost for the malpractice insurance for the physician changed. It went down. That was it.
Rafiq, go ahead, please.
Couple of questions. One, there is some regulation where they have taken off the cap on how much insurance companies can spend on you. There was a limit on it. Is that still in place, or is it?
Yeah. So starting this year.
Second question was, you said about 8.9% or 9 point some percentage of the income is the maximum you can spend on in health insurance, or the whole health, including premium and the cost?
Out of pocket. Okay. So to answer your last question, the 9.5 was the amount you will be required if you are 400% of the federal poverty line or lower. So that's around $88,000 for a family of 4. If you are within that range, you will not be required to spend more than 9.5% of your income on, make sure we get this right, on out-of-pocket expenses. So you will never be, and that means deductibles, copays. That does not include premiums. Your first question was in regards to caps on, so starting this year, health insurers will not be allowed to have, so a lot of health insurers have lifetime caps of like, they will only spend $200,000 on you over your entire lifetime. Or they'll only spend $50,000 on you annually, or something like that. A lot of insurers do that. Starting this year, they will not be able to have lifetime caps. So this really comes into play if you become severely ill, if you have some sort of cancer or something like that. By 2014, they will not be allowed to have annual caps either. So $50,000 or $100,000, something like that. that will eventually be phased out as well. So yes, that will make a difference and this is most relevant for people that get really sick with serious conditions such as cancer.
And that's effective now?
The lifetime cap will be effective by September. The annual cap will be effective by 2014.
We posted a questionnaire online for this session for people who are not able to come to this talk. Even the questions are repetitive, I would appreciate if you can answer. I already have insurance through my job. Is this plan going to cost me more?
Most likely not. The effect to people that get their insurance through their job is going to be minimal to nothing. Like for instance, I get my insurance through my employer. They've already sent a thing saying there will be no changes. It will not affect them. So obviously it depends on where you work and how generous your employer is or what the costs are. But for the vast majority of people, there will be no noticeable effect. Most people won't even. It will have no significant effect on them.
I'll read one more and then I'll get back to you guys. If I don't have insurance now, will I be forced to buy it and will there be a government help?
By 2014, you will be forced to buy it. There is a mandate. But if you cannot afford it, you will be provided help. And that, again, is to 400% of the federal poverty line, which is $88,000 for a family of 4 in 2010. You will be provided subsidies to help purchase the insurance. Those subsidies go to the premiums. And then you will also be, your out-of-pocket expenses will also be capped. So the idea is that it will be affordable and you will be able to purchase it.
How can they force you to buy the insurance?
Uh,
I mean, you're not hurting anyone. In car insurance, you have to have car insurance because if you go and hit somebody, yeah, the insurance will pay. But if I'm not hurting anyone, I said I don't want to buy the insurance.
Well, here's the thing. In order for insurers to control their costs, it's like any insurance. There has to be a large pool to spread risk. So if only sick people buy it, then it becomes very expensive and the risk is not spread. So the idea is that if everybody in the country is required to have it, the risk is spread to everybody, the healthy as well as the sick, and therefore it evens out and the premiums are lower, costs are lower, etc. So that's
socialized medicine, basically.
Not necessarily socialized medicine, but that's how insurance works in that you have to spread the risk. Because if the risk is too high, then the cost is too high.
Plus the uninsured is costing rest of us the money because if I happen to be in the accident and has to rush to the hospital cannot refuse the treatment, but I walked out without paying a penny to them. So that's another explanation that I'm still costing, or I go to the Cook County, or I go to some hospital in DuPage County. So I do cost the society in general some money without contributing anything.
You're absolutely right. That right now, even if you have insurance or you're healthy or whatever, you still help subsidize people that do not have it because of things like going to the ER or other limited or free health services that people can access.
We have a question from Bashir.
Earlier you mentioned that this may help people who are making less than $85,000. So that is not help at all for the people who are making more than 85. And the second question is, will the premium goes up if who are making more than 90 or 100K?
So the premium, one of the unfortunate things about this